Ready?
Yes.
I am Safa Jaddin. I'm working as a diabetes educator, mainly in adult setting. I have experience more than 7 years in diabetes education, and I'll just give a chance for Fatima. Can you introduce yourself?
Yes, I am Fatima Saleh. I am working as a diabetes educator at Rashid Center for Diabetes and Research at Sheikh Khalifa Medical City, Ajman. Yes,
Nice to meet you all.
thank you.
I am Pamela Durant. I'm the founder and managing director of DiaPoint. I am a healthcare manager by profession and also a certified coach. However, I have a child with type 1 diabetes. He was diagnosed at 18 months old and he's now 18 years old.
Okay, nice to meet you.
Nice to meet
Thank
you.
you.
Nice to meet you, Pamela. And we'll just ask some question for you from your knowledge, experience as a mother and healthcare professionals. Why does the generic diabetes education often fail?
A few reasons, but one of those can be maybe, as we're here to discuss, cultural differences, depending on language barriers, because we're in the UAE, and while so many things are in English, I believe at last count there was almost 200 different languages spoken in the UAE.
Yes.
So sometimes people may not actually be understanding, and as we just saw a presentation earlier today, that you all use visual aid and different things to help explain to a mother what to do, and sometimes even for certain foods from certain cultures, if we need carb counts, there's not carb counts. Other reasons can just also be where that person is in their diabetes journey and whether or not they're ready to take on new information. Diabetes can be overwhelming. It's overwhelming at diagnosis, and at different times in our lives it can be overwhelming for different reasons. So sometimes taking on new information or new education can be a lot.
Yes. So, like when you said I am a mother, I feel you are a hero. Really, you are the one for taking care about the child management, everything. You are the one dealing with it. So, because we are taking care about patient type 1 diabetes, so we know how it's difficult. Another thing I want to ask you, how you feel that culture will influence diabetes education here?
Yeah, thank you for that. I don't think any mom would really say they're a hero. We're just doing our job as a mom, but I know you see it every day.
Yeah.
You see how difficult it is, and it is difficult. Fortunately, my son, or not, was diagnosed very young, so he doesn't know life without diabetes. So that made some things easier, but some things more difficult. And so the next question was culturally.
How culture will influence the diabetes education?
How culture influenced the diabetes education. My son was born in the UAE, proud resident for 20 years. He's had various diabetes educators throughout his life, and they've been from different cultures, also doctors from different backgrounds, different education, different countries. And I think it does affect culture. There are some, the baseline of diabetes, how it's treated, how we use insulin, and all of the different things are the same very much. So that kind of lays the foundation. But for children that are growing up in the UAE that are exposed to many different cultures, they're able to understand. And the same thing for parents, because we're all, again, all working in English. If we're able to speak English and understand, then we're a little more open and flexible when it comes to different cultures and taking messages from different cultures. I did find that sometimes when it wasn't necessarily a challenge of culture, but just a lack of time or availability of an educator, that I would have to supplement information or go research a topic more to understand. So it's not really a flaw of being multicultural. It can make it more challenging sometimes,
Yeah.
and not so much the culture, but also just the lack of time, because you have many patients to see in one day, so you have to try to cram everything into one appointment.
Pamela, what adaptation is required in the UAE?
We need more educators, for sure. I'm sure you will agree with me.
Yes.
I
Yeah.
think when my son was diagnosed at 18 months old, which is almost, 17 years ago, there were no pediatric endocrinologists in Dubai. We live in Dubai, and very few in the UAE I was not aware of. And of course, why would I be? I didn't need one until he was diagnosed. I don't believe that there are enough educators, so I would love to see more nurses dedicating their life to this. I do believe it's a calling because every diabetes educator I meet is so dedicated, very special, following up with the patients all the time. I believe supporting the continuing education of nurses to become diabetes educators and also recognizing that, really focusing on that as a profession and a certification within the legal framework would also help. And there's just not enough human resources. I think that's the biggest thing, is encouraging more people to become diabetes educators is the big first step.
Yeah, I just want to share the one quality project we did in our hospital for the pediatric patient. So we trained the nurses to become an expert in diabetes education. So when the family they are admitted for newly diagnosed, they will be surrounding with all the nurses who they know well about the diabetes. So they will grab the experience and the knowledge more easily, and they will feel supported, and they will not feel they are alone.
I love that you did that, because there have been times when very early on, my son had a couple of DKAs. One was a kinked insertion site, and again, because I had no doctor or educator to tell me that these were possibilities, I had no real idea. But when we went to the hospital that was available to us at that time, no one knew anything about diabetes, had no idea. And just having even a general understanding of type 1 diabetes versus type 2 diabetes versus gestational versus other types of diabetes is really important. I'm really glad to hear you did that. I think all hospitals can also implement that and follow your lead.
Yeah. I think it was useful because we will just continue what they start.
Yes.
So during the admission, the patient that will be gain the knowledge gradually. Mother, parents, they will be supported. They will feel confidence when they will be discharged. And actually, with education from the day one, they will feel that will absorb the shock of the diagnosis for the parents.
Yes. Yeah, it does help, because also people need to see other specialties too throughout their lifetime. So having a doctor or an educator or nurse or someone that understands also a little bit about what they're going through can help, for sure.
And also, if you are waiting long time for people who know or who will explain to you, your anxiety and stress going more and more. And as a mother,
this is
very
true.
difficult.
It is very difficult. Yes. Yeah, it is. And when someone doesn't know to explain to, let's say it's a case of an emergency, to explain that first point of contact when you walk into an emergency room, that what you're dealing with, if it's DKA, is very urgent or an emergency. It's not like sit down, you have the flu, although flu can be very urgent too. It can feel very isolating and frustrating.
Yeah. And also now it's very fast. People will start searching. Before seeing the doctor, they will search, find something wrong, something okay. So it should be somebody who will guide from the beginning.
Yes, that's very true, because we do look things up before we go to the doctor to see.
Yeah.
And yes, sometimes then also patients might jump to wrong conclusions.
Yeah, I think all people now, they have AI, they can search in Google, but this is not, they will not be replaced by the human touch while diagnosed.
Not the human touch, but also doctors and nurses and educators have the wisdom and training and experience that AI doesn't. AI will transfer knowledge, but it cannot fill all of the other roles.
The-
So I'm a big advocate.
The
for
emotion
doctors.
side.
Yeah, the emotion side. But I always say, like, make sure you're going to your doctor or following up with your diabetes education team. When someone in our community says, oh, I'm using AI, even for something like carb counting, I get a little nervous because I'm like, double check it, because you're giving insulin against something that has not been clinically tested. Can be a little stressful. It's helpful, but yeah.
Because we treat patients with empathy.
Yes.
This is the missing while searching and
Yes, this is true. This is true.
Okay. So here, UAE, you know, we have different people coming from different countries, and most of the time there is language barrier. So, in your opinion, how this barrier should be addressed?
So that's very interesting. There's a lot of different ways that we can do that. And for hospitals and clinics are often, especially in the private sector, the primary language for all of us to communicate is English. I do know people I'll use Turkey as an example because I lived there for many years. I speak Turkish, and I often see a lot of Turkish moms that they'll seek out Turkish physicians because it's so much easier to comprehend and understand something in your own
Communicate, yes.
language. So, you know, there's no harm in bringing in a good qualified doctor or educator from another culture that speaks another language. And then if you can even market that you have those languages within your clinical practice, then I think that would be an amazing start, one. And actually, as I was sitting listening to the presentations today, which were all very, very good, but I started to also think, because we are in the UAE, and most of the presenters, particularly in the educator session, are native Arabic speakers. So why not give those in Arabic, and then we can have simultaneous translators? Not in the clinical setting, but maybe in the educational setting, because then also the transfer of knowledge would be very different. And I think you can do a deeper dive. And I say that as someone who's given presentations in their second language. I'm very comfortable doing it in English, but in another language it's very stressful, scary. You're so worried about saying it correctly that you might forget the overall message. So the transfer of knowledge in a clinical education session like this could be in Arabic. But I think in the clinical setting, knowing the populations that you're serving, and if you see a gap, then try to bring a physician educator or someone that can help support.
Pamela, what the role does the family play in education?
Oh, the family plays a big role in education. I often say when one person gets a diabetes diagnosis, it affects everyone in the family.
Surrounding the patient.
Yes, everyone, and not from a eating perspective, because when people, the general public, think about diabetes, they're thinking of special foods and carb countings and things like that. But it's not just that, it's the whole psychosocial aspect of it. Understanding the carb counting, but understanding how challenging it is to manage. Understanding when you need to check blood sugars. If it's a child, then understanding the stress that's on the mom or the primary caretaker parent or whoever is doing it. If there's siblings, if you have a child diagnosed with type 1 diabetes, then it affects the siblings because the siblings are getting less attention. They might resent that over time. It affects everyone in the family, so everyone in the family needs to be educated, and also how to understand if there's ever an emergency or urgent issue, or what to do if you have a child with type 1 and they're going somewhere with their brothers and sisters, then they need to know how to support. So it affects everyone. No one is left untouched by diabetes.
Yeah, sure.
So how we can build the trust with patients? How's the trust?
How can you build trust? That's in this day and age, I think that's very difficult, because also they see a lot of things online. They were maybe questioning before, but now even more they worry. So I think one of the biggest things or easier things to do is to listen when someone feels heard or they feel understood, and then they'll trust you. It may not be in the first appointment. It may take a few times of seeing that patient over time. And as you get to know them, they'll trust you more and more. Like I mentioned in the session where I talked about coaching today, asking the patient their opinion about the care or about some clinical directives that you're going to give them, even though maybe there's not much room to deviate from your clinical recommendation, but asking them, what do they think? How can they implement that into their life? Do they find it easy? What would make it easier? Are they finding it difficult? How can you help? Those kinds of questions that will help them feel heard and more confident in their relationship with you, and then I think you'll have their trust.
Yes.
So, from your coaching, supporting, teaching the patients, how you measure that what you did is effective and it's valuable for the patient care? How you measure that?
How do you measure in patient care? So in the patient care setting, if I was working in a clinic, I would, of course, look at the clinical outcomes to measure, to see if you're effective. Of course, HbA1c, time in range, and these things. But there's also a lot of surveys in the research that you can look at about patient confidence, how they're feeling about their care. And maybe it's not a bad idea to do one of those early on, maybe not right at diagnosis, but after you've seen them for a while, ask how they're doing. And then maybe do the same analysis later and do a comparative analysis. You can ask them about satisfaction as well. I think that can be very subjective depending on the person. So if someone's happy or satisfied, that doesn't necessarily mean your clinical outcomes are good. But constantly measuring and asking them. You can ask them open-endedly as well how they feel. Do they feel comfortable?
And also the interaction during the session, when they will come up with questions, they will express their feelings, satisfaction, and even sometimes patients, they are share their private life even.
Yes. Oh, I'm sure a lot. I'm sure a lot. You can also even ask them, is there something I can do to better support you? And then they'll tell you.
I just remember now one lady, she's in 60s. She's always coming with a bad A1C. And she always said that I'm so stressed because of my bedridden mom. I am the one taking care of her because I am only one daughter.
Oh.
So when we start discuss with her which the hard time about caring your mom, then she said turning, lifting, give her bath, this is my hardest part. So I just start to suggest her that there is patient lift, she can buy it from Amazon, that's helpful for her. Then after that she became interactive, that she feel that I'm supporting her, yes. I understand her. So when I show her, she said, oh, then class I will have enough time to care of myself because I'm using this one. It will reduce the time consumption to care my mom. And then she went happy. I'm just waiting her for next visit and see.
Yeah, that's amazing. I'm sure that is a true amazing story of how to support someone. Yeah. They might come to you and it may seem counterintuitive, or maybe some people might think that that's not really giving care because it wasn't a clinical discussion. But that was probably life-changing for that woman.
Yes, because she will feel that we need to help her. We can give a suggestion that will amazingly help her.
Yes.
And
that's wonderful.
Yeah.
I hope that she has a good experience with it. That's amazing.
Thank you. It was an amazing discussion with you, Pamela, and we were happy to meet you and looking forward to see you again.
Thank you both. Thank you. And thank you for the work you do.
A good chance to meet you. Thank you.
Thank
so
you.
much.
Thank you.
Thank you all.